Muchas gracias a ti, Jaime.
Thank you very much, Jaime, for inviting us to epistemological rupture that will allow us, together with the instrument of critical epidemiology, to raise a new model of social determination of health. You stay with us until 4, please. We want to invite Roberto Passos Nogueira so that he will be with us for the rest of the afternoon, because the presentation made by Roberto supplements perfectly with Jaime's presentation. Roberto is a researcher, Brazilian. He comes from the Economic Applied Research Institute, has a lot of experience. He was president of general director of Citi. In the Senate, he had the possibility of conducting a full project where the issue of social determination was of the essence. We all recall this text of Seves, in which one of the key topics that is raised is the one that is going to be developed in his presentation by Mr. Roberto, which is the issue of social determinants or social determination. Consistent with what Jaime just said, we are going to give the floor to Roberto. We are to listen to Roberto, and then we are going to open the floor to have an exchange of ideas between the speakers and the audience.
Good afternoon, everybody. I'd like to thank first of all the invitation from our friends from ISACS. We are here in continuing a certain discussion that we began between our two institutions. Those of us who are concerned with this matter, with this issue of social determination of health for a long time. Actually, we are at the base of social medicine. It's not something that began only with the WHO report, which is even progressive in certain aspects, but it has a certain meaning of paradigm of the social medicine, which we support and we believe on. Can we see my slides? The name I gave to my presentation was the following. We, critics of the social determinants of health, beyond semantics. I mean, we, critics of the determinants, of the theory of the determinants, such as it is traditionally seen by WHO. It is right here in the title of our workshop. But trying to go beyond this semantic, traditional semantic, which means, in the sense that was given by Jaime, where the concept of determination leads us to think a broader base within a social process, and social natural, historic one, of what is our society, such as built based upon a certain conception. The difference we understand between the theory of determinants and the theory of determination, which we identified between these two conceptions, one linked to the traditional epidemiology and the other linked to the social medicine and collective health, is that the conception of determination has a theory of society behind it, which means there is an historical social understanding of health and of society. Meanwhile, the traditional epidemiologic conception, and here Jaime is absolutely right, this conception converts the social factors into natural factors, and it's the same game of the old epidemiology, but now we haven't seen the social elements.
slide é esse. Então, assumimos que o processo
We suppose that the process of social determination of health must be understood through a theoretical reference. And this theoretical reference does not refer only to an isolated society, but rather the ensemble of the world international interactions, which are uneven relations. I will single out 4 critical knots understood as epistemologic obstacles, difficulties to understand what is social determination of disease and health, based upon the traditional conception, epidemiologic traditional view. Beyond semantics means that we refuse, absolutely, to reduce this understanding of the dynamic of the social process that sets in one side health and the other side social groups only based upon causal factors. The first critical knot: analysis of inequalities is usually done based upon certain indicators such as revenue, which is the most traditional one, is the Gini indicator. Such indicators are applied within a single country, and we see how is the revenue, the individual revenue in different social groups, what is the trend for growth or decrease of the revenue composition between different social groups. What we like to leave as our argument here is that the international relationships, differences, economical social difference between countries determine all the conditions of equality or inequality on the social level, or health or inequality, health or equality or inequality in the health plan. This is the main point here. We cannot interpret the dynamic of inequality in health or of any social inequality based only on what happens in a single country, in Brazil or in another country. The question is, when we find a trend towards equality or inequality, the question is, what happens in the world? What's happening in the world meanwhile, which favors or hinders the social equality in health? It's a pleasure to have you here, sir.
So, in the report of WHO, the issue of the worldwide system appears as a concept of globalization. However, the understanding of globalization is not projected in the reference of interpretation of the origin of the genesis of social inequalities. So this is an example, but it's not a real context. We all know that inequalities in Latin American countries are decreasing in the last few years. We had a very interesting presentation this morning that mentioned how Latin American countries are reaching an income distribution rate that is much more favorable, and this is a process of the decade of 2000. So we could ask ourselves, why this decrease of social inequality occur? With what fiscal base, with what economical base was it possible to have income transference policies? Obviously, these policies have to do with sovereign decisions of the states. They're not determined by economics or by economical agents. However, perhaps if we did not have the effect China, that is, the presence of China as a commercial partner, more and more important in Latin America, if we didn't have the surplus of Latin American countries, especially in commodity exportation, mineral or farming commodities, if we did not have this world condition, we would not be able to have the decrease of inequality that was mentioned this morning. On the other hand, it was exactly in China where we are having an increase in social inequality in an extraordinary way regarding what has been mentioned during the time of the Chinese Revolution. So a capitalist elite of 1% of Chinese who are the millionaires from China. If on one hand, China favors Latin America, on the other hand, China creates in its social economical conditions an elite group more and more enhanced. And therefore, it creates an internal inequality in that country. In the United States, what is highlighted is the financializing of the economy. What happens is that the United States is benefited by an elite that is 1% that was the target of the movement of occupying Wall Street. All the people that are at the front are the great worldwide financial groups. So there is inequality in the United States, and it is related necessarily to what is happening in world terms in the socio-economic social crisis that we're going through. This is a graph that shows the Gini coefficient for Latin American countries, and it has to do with what was analyzed this morning, showing that inequality in this set of countries has been decreasing. That means that Gini has been dropping in its numerical value, and the exception is Uruguay, but Uruguay had levels of inequality very reduced at the beginning of this decade. That means that we're all levering ourselves to Uruguay. So this is an interesting fact, because we're reaching to a point that such a small country as Uruguay is a guideline for income distribution, also for the educational issue, because they have a very differentiated level of education. Let's give as an example now. I don't know if the numbers are visible. For example, in China, what is happening with the group of 1%, of the richest 1% of China? You can see in 1991, this group concentrated 3.4 of the national richness. In 2003, it concentrated 5.9%. After that year, it was impossible to collect information on China. That means they didn't inform this to national bodies. South Africa is another example of concentration. Also, the United Kingdom and the United States is highlighted specifically. 1% of the richest people in the United States concentrated in 1991 in 12.2%. In 2001, it started concentrating 16.7% of the national wealth. This is, in fact, not only the revenue, the income, that in the United States you include the properties, the assets, and the wealth. And so we would like to specifically highlight is that what is happening in Latin America has to do with this differentiation of income and property and assets that happens in China and in the United States. These two worlds are linked. And most of the analysis that are made in our countries, they consider only what is happening here and now. They don't consider in what world we are living that will make it easier or more difficult to reach a greater social equality or a greater health equality. So, the premise that we adopted here is the following. In this world system in which we are embedded, increase and decrease all the inequalities of lifestyle, and this is linked to the global market and also to the social protection mechanisms. And these mechanisms respond to what happens in economy. That means if you don't have an independent social protection part to what is happening in the global market. Another issue, as a consequence, and according to the decrease or growth of the economics, and we're going through a decrease, the labor market and social market are exclusive or inclusive. So this is just to highlight how much the labor market, the social protection, has to do with this economical world cycles and has to do with the possibility of equality in health or socially as a whole. So it's a contradictory movement, it's a continuous movement in a certain way, unavoidable, and it also considers everything to do with health. Let's mention here a liberal economist. I'm not going to talk about any leftist or Chomsky or any other. I'm going to consider Joseph Stiglitz, who was an economist of the World Bank. And he is a very respected liberal in the United States. He says, I'm going to read this a little bit. The recent growth of income in the United States occurs mainly in the 1% of income distribution. As a result, there is an increasing inequality, and those in the low or in the middle part are really in the worst situation now than at the beginning of the century. 20th century, 21. The inequality of wealth are greater than inequalities of income. That means of assets. Inequalities are evident not only in income but in many other variables that reflect life standard like insecurity and health. Life is specifically tough in the lower line, and recession made the situation worse. There has been an emptiness of the middle class, and there's very little income mobility. The idea that America is a paradise of opportunity is a myth. Who is saying this is a liberal economist? He is not saying, he is not a leftist. So America has more inequality than any other industrialized country, and this inequality is growing. This is the conclusion of the book, The Price of Inequality, of Joseph Stiglitz. To complement this evaluation of the United States, I would like to mention as well the evaluation on equality of citizens made by French historian Pierre-Rosan Vallon, who wrote a very fantastic book. It was published 1.5 years ago, La Société des Égaux, the Society of the Equal People, Society of Democracy. And he considers French democracy and American democracy, and he shows the differences and the same things of both societies. He says we must have a redistribution, also solidarity in society. This word that was mentioned by him this morning. But in order to have solidarity, we must have a feeling that we belong to a common world. That means solidarity is not made by a program. No program of a government creates solidarity, even if it's a very important government. What we lack nowadays in our society is a possibility of remaking the citizenship that makes us all equal, not only equal in income, but equal in the lifestyle. So this is what happened in Europe. If the state gives well-being and became important because they had the experience of 2 world wars. They were the ones that created the base of solidarity among those who suffered this condition. And then afterwards we had the fear of revolutions. And this was so important, says the author, because they had a feeling of unhappiness that resulted. They thought about a better life through a well-being state. And the problem of our society is nowadays we don't live as equal. This is the conclusion of Rosan Vallon, this extraordinary historian, French, that I hope that this book is published in Portuguese and in other languages. Okay, we're coming to some conclusions now. Equality in health, like any other one, it has to do, it reflects the level of maturity of the equality of the citizenship or democracy of a specific society. The citizen equality is not an automatic reflection of the level of income of the population. This is obvious. Sociologically, this is obvious, but we forget this. Due to some reason, because of advertising or even interests, political reasons, we forget that citizenship equality is more expressive and lasting and real than income equality. So income distribution is a mechanism that links to create solidarity required to the building of the citizenship equality.
Ponto. Seguinte. No crítico número 2.
Number 2.
Eu vou caminhar pouco mais rápido agora.
I will be briefer now.
A determinação social
The
da
social
saúde
determination
abrange
of
a
health
influência
covers
perniciosa de
the
certas
bad
indústrias.
influence of some industries.
Isso não está
And this is
no
not
modelito lá
in the
do
model
Diagram.
diagram
É muito
halt
bom que
head,
se enfatize.
and we have to really highlight this.
vou tomar como
And
referência
I will
aqui o
take as a
artigo
reference
recente
a recent
do Carlos
article
Augusto Monteiro,
of Carlos Augusto Monteiro that was published with other authors in the Lancet. What does he say? What do these authors say?
Através da venda
Through
e
the
promoção do
sale
tabaco,
and
álcool,
promotion of
produtos
tobacco,
processados
alcohol,
e bebidas,
and
commodities
processed
de saúde,
food,
as
commodities,
corporações
unhealthy
transnacionais constituem os principais
transnational
pilotos da
corporations are the
epidemia
main
global
pilots of
de doenças crônicas
global
não transmissíveis.
epidemics
Devemos
of
salientar o aumento
non-transmissible
nas vendas desses produtos de
diseases.
saúde
We
em
have
países
to
de renda média
highlight the
e
increase
baixa,
of sales
que
of these
encontra as estratégias
products
comuns
in
utilizadas
high and
né,
low-level countries
para minar o
in order
controle e a
to
prevenção das
not
doenças
allow the
futuras
control, the
não
prevention
transmissíveis.
of these kind of diseases.
Podem olhar
You can
na discussão
observe in the
da
discussion
determinação social
of the social determinants
saúde,
of health.
raramente
Very
aparece uma
rarely
referência
we have a
às
reference
indústrias como
to industries
atores,
as
protagonistas da
players,
desigualdade social em saúde.
characters of inequality in health.
Por quê? Porque atuam
Why? Because
seletivamente sobre
they
certos grupos sociais.
selectively are acting under specific social groups.
No crítico número 3. E eu estou colocando
Critical
isso aqui,
node number 3.
no crítico no sentido de obstáculo
Saying a node
epistemológico.
as an epistemological obstacle. And Paulo Drew said, studied with me in the 70s, and we know very well, Paulo, that Roberto Machado.
O corte epistemológico e o obstáculo epistemológico.
Yes.
Então, o obstáculo epistemológico é aquilo que nos
The
dificulta
obstacle is something that
ver a realidade a
hinders
partir de
to
uma
see
teoria que é
the
um
reality
preconceito.
as
E a
of a theory that
teoria
is
dos determinantes sociais da saúde acaba se constituindo
bias,
num
and this
preconceito
becomes a bias that
como disse o
excludes,
Hyman,
as Hyman
outras
says,
visões
other understandings of the world.
Então, atualmente, há
So
uma
currently
forma
we
de
have
determinação
a way
social
of social
que
determination
aparece por conta da
that
indústria
is
farmacêutica. Veja bem, não
due
é
to
produzindo
pharmaceutical
coisas
industry,
danosas,
not
falsas,
producing
o que for.
bad medicine
Tem a
or
ver com
whatever. It has to
doenças
do with
inventadas,
diseases that are
né?
invented.
Quais são essas doenças?
Which are these
Disfunção
diseases?
erétil, né?
Erectile dysfunction,
Distúrbio de efetividade,
effectiveness, hyperactivity,
disfunção
and
disfunção
attention,
sexual
sexual,
feminina,
female
etc.,
sexual dysfunction, and so on. So
estão sendo criadas doenças
diseases
imaginárias.
are being
Ora,
imaginary
isso não
diseases
é
are being created.
Uma determinação social
Is that not a social determination of
ou a
health
determinação
and disease,
da doença,
or is it
criação de novos
the
entes,
creation of
entidades
new
mórbidas,
entities,
entre aspas,
morbid entities,
que são divulgadas como
which are
perniciosas e precisando
supposed to
de
be
certos
pernicious and
medicamentos
requiring certain
tratadas?
medicines,
Isso
certain
tem
drugs.
sido chamado de diseasemongering.
This is called diseasemongering in English.
É a vendagem da doença de tal modo a
Selling
ampliar seus
diseases in
limites e
such a way as to
favorecer
enlarge
o
its limits
crescimento dos
and
mercados
favor the
de
growth
venda
of the
ofertados.
markets of
O
sale
monger é o
of treatments.
vendedor
The
ambulante,
monger is the traveling salesman.
uma forma ambulante.
Is a traveling salesman of
O nosso
disease.
crítico número 4.
Number 4, critical knot.
Determinação social da saúde
Social
abrange o
determination of health
comportamento coletivo
includes the
da
collective behavior
ameaça de
facing the
certas
threat of certain epidemics.
Não é a questão das epidemias em si.
That's not the epidemics themselves, but the fear of it, the risk, the possibility, the collective panic. All of this, it lies within
fenômeno social
a social phenomena
e não é explicado pela
which is not explained by the determinants of health and disease. It's a behavior that has been observed, for instance, with the swine flu. Everybody remembers in the early beginning of the present century, the swine flu. I think it was 2006, 2009. 2009, yes. So, what is the social determinant of this phenomenon? How will it be explained through the traditional model? There's no way how to explain it. And still is something lived. It's lived through by all of us as a reality that has to do with fear, but in itself, it has become a more morbid behavior as compared to this threat. The issue is to know which risk is this, which threat is this. When it is imagined, how will that fit into the theory of the social determinants? I'm getting to my end.
E o final tem a ver com o contexto, né, do consumo em saúde, que falava.
This has to do with the context of consumption in health. Consumption in health is progressing in the sense of replacing the consumption of weapons as effective demand for the economy. During many years, it was weaponry. The weaponry raised the Cold War as the way to keep the economy revved up. Now it's up to the health. We see this in the United States with the consumption of 18% of its GDP with health. Brazil will soon follow this model. And it has to do also with a search, a crave for new technologies, which creates this effective demand. All of that put in the borderline of knowledge, labeled as innovation. All of that having to do with a certain theory of development associated with health, and seen positively by us health professionals, because it puts health as an agent of development. Nevertheless, this can be feeding a race for health in the sense of keeping the world economy revved up. This can be the reality of the coming 20 or 30 years. Let's not underestimate this possibility. This is also a way to generate inequality, which brings the expectation of a consumption, almost a limited consumption of high complexity inputs. And this expectation is often translated into court cases, as we see in Brazil. Court cases for the treatment of rare diseases with very expensive medicines. Therefore, we are in this context where health becomes ever and ever more important economically. But we should not commemorate this. Why should we be happy about that? Just because it is us who are in the limelight. Shouldn't we look with much care and critically this trend to make health one of the centers of capitalist consumption, an object of desire of capitalistic consumption, and is a highly doubtful health. It's a health that's not healthy, like Ivan Illich said. It's a pathogenic health, often. So with these comments, I close my presentation, and I thank the invitation to be